Jill here, Special Needs Mom Talks. Yeah, so I was going to talk about something that's a little bit abstract, but then I got another inspiration, something I'm dealing with personally that's kind of funny and kind of hopefully somebody will relate. But it's the school nurses. Now, I've shared that I've been a caregiver for 26 years, and I've dealt with a lot of school nurses. And as a special needs parent, uh, you end up retaining and learning a lot of your offspring's medical history, and you have to interact on a certain level with each school nurse that your child, whatever school they're in. And I will tell you this, my son switched schools like 800 times, not 800, but a lot of times during his trajectory. And again, this channel is not supposed to be about my kids, but it's supposed to be about my feelings and how they relate to things that are going on, and these topics that other people that have kids that have special needs might relate to, without insulting anybody and in any ways. And I have to have a sense of humor about it a little bit. So, you see the numbers come up on the phone, it's the school nurse's office, or it's the school district, and your day is probably going to be hijacked, or some piece of your day. At least that's sometimes the way I get triggered, because it's happened for so many years, periodically seeing those numbers come up and then interacting with the school nurse, that you kind of become a pro at it. So you kind of got to break them in, especially when you're dealing with a lot of medical issues, and they need to know about medications, and they need to know, the parents have to be really involved. They have to know about the medical history and what could happen, and who the connections are at the specialist's office. I mean, they need to know some stuff, because realistically your kid might have a seizure at school, or something like that might happen. And it did happen a lot. So anyways, you get to be kind of on good terms. I always really tried to get along with the school nurses. Over the years, I got a little bit edgier and edgier, because I just really didn't want to be called for this little tiny thing, because they get really nervous a lot of times. And God bless the school nurses. Oh my gosh, that job is just amazing, amazing, amazing. And I loved so many of them. I think almost all of them. And yeah, and they were really concerned, and they call a lot, and I just have to reassure that they didn't need to call every time. So I think I got the last school nurse that we were dealing with was pretty, she didn't call me over every little bump and bruise. And because sometimes, at least I know my son would go to the nurse a lot, and for good reason. He was nervous. He didn't want to, have seizures or whatever. So anyways, I got a call, let's see, was it yesterday, from the school nurse. Now he's 21, and I'm like, he just changed schools. School just started. He just started a new program, and I'm like, oh my gosh, it's a call from the school nurse. It's like the second week he's going to be out, because he's been out a lot. Sometimes there's some behavioral factors that factor in to the not feeling well. And, you never want to cry. You never want to accuse him of crying wolf. So we just go with it. You're sick, you're sick. So, but sometimes, I'm not sure. And obviously on some level, there was a break needed. So I always just try to just be as patient as possible. But anyways, the school nurse calls. I'm like, oh my God. Okay. So again, I have to be on good terms, and we've got a new school nurse, and I've got to break her in, and I just am tired of it. I've been doing it for a long time, and I don't want to get any calls from the school nurses, but I appreciate them. And that's just a little glimpse out from my evening. Maybe some of you can relate. And yeah, we all learn to work together one way or another, because got to make it work. Much love.